Medicaid versus Medicare. Who qualifies? Medicaid and Medicare are the two largest public health insurance programs in the United States, but they are designed to serve different populations with distinct eligibility criteria, coverage scopes, and funding mechanisms. Understanding the differences between Medicaid and Medicare not only helps individuals determine which program they may qualify for, but also supports better access to healthcare services in a complex healthcare system. Medicare is a federal health insurance program primarily intended for older adults, specifically those age 65 and over. In addition, Medicare also covers a smaller group of individuals under 65 who have severe disabilities as certified by the Social Security Administration, or who suffer from end-stage renal disease, ESRD, or amyotrophic lateral sclerosis, ALS. Everyone who meets the criteria is eligible for Medicare regardless of income, assets, or location within the United States. Medicare consists of four main parts. Part A covers hospital and inpatient nursing care. Part B covers outpatient services, doctor visits, and some medical supplies. Part C, Medicare Advantage, includes private plans that replace Parts A and B and often offer additional benefits. And Part D covers prescription drug costs. Enrollees in Medicare typically pay monthly premiums for Part B and Part D, and may also incur other costs such as copays, deductibles, and out-of-pocket expenses. In contrast, Medicaid is a joint federal and state-funded program designed to support individuals with low income, including children, pregnant women, people with disabilities, the elderly, and low-income adults. Since each state manages its own Medicaid program, eligibility requirements and benefit coverage can vary significantly from state to state. However, certain federal standards must be met, such as providing coverage for specific vulnerable populations. After the passage of the Affordable Care Act, ACA, many states expanded Medicaid to include all adults with income below 138% of the federal poverty level, FPL, although not all states chose to participate. Medicaid tends to offer broader coverage in terms of services, including long-term care, which Medicare generally does not cover. When it comes to costs, Medicaid typically requires little to no premium or cost sharing from beneficiaries, while Medicare has a more complex cost structure. For those with extremely low income or minimal assets, Medicaid often involves no out-of-pocket expenses. In some cases, individuals with slightly higher incomes may be subject to cost-sharing programs, but overall, Medicaid is the most affordable option for low-income individuals. Medicare, on the other hand, while subsidized by the federal government, still requires participants to pay monthly premiums for specific parts of the program, along with deductibles and copays. In terms of qualification, Medicare is an entitlement program. Individuals are automatically eligible upon meeting age or disability criteria. Medicaid, however, requires thorough income and asset verification and lawful residency within the state of application. Some people qualify for both programs, referred to as dual eligibles. For these individuals, Medicare serves as a primary insurer, while Medicaid can help cover costs that Medicare does not, such as copays or additional medications. This group often includes people with complex health conditions who require significant financial support from both systems. Another key difference lies in administrative structure. Medicare is a nationally uniform program managed by the Centers for Medicare and Medicaid Services, CMS, while Medicaid is a federal-state partnership allowing states to design and run their own programs under federal guidelines. This means that Medicaid varies widely across the country in terms of policies, enrollment procedures, and coverage, a contrast to the standardized nature of Medicare. From a policy perspective, Medicare is often seen as a benefit earned by individuals who have contributed to the tax and social system over a lifetime, whereas Medicaid is viewed as a social welfare program for the poor. This distinction is not only administrative, but also reflects broader societal and political attitudes toward healthcare resource allocation in the U.S. policy debates over Medicaid and Medicare reforms often center on issues of funding an aging population and the need to expand coverage toward a more universal healthcare system. In summary, those eligible for Medicare are primarily individuals age 65 and older or those with severe disabilities, while Medicaid serves people with limited income and who meet state-specific residency and income requirements. Each program has different goals, yet both work to reduce the healthcare burden for the population. In many cases, individuals can qualify for both programs, helping to maximize benefits and minimize out-of-pocket costs. Understanding these differences in eligibility rules can help Americans, especially vulnerable groups, better access essential healthcare services within an increasingly complex and expensive system.